Hi, I am Dr. Amitabh Banerjee, speaking from Universal Health Organization, UHO. This is a watchdog registered which gives the commentaries, analysis of health issues. And we established this organization during the pandemic, COVID pandemic, when we noticed a group of us, doctors, data scientists from IITs, clinicians, journalists, lawyers, when we noticed that a lot of scientific principles and were being violated in public health policies. That's a different story. We have got a website, uho.org.in. We'll be giving the link. And among our activities, we have talks, panel discussions, we have newsletters, weekly newsletters. Every Friday, we bring out a weekly newsletter, and we are making a video every week on newsletters. Up till now, we were making these videos in Hindi for wider dissemination among the Indian population. And of late, there have been a lot of demands to make these videos in English also. So from this week, we are starting both. We are making Hindi videos and weekly newsletter in English also. So I am just giving you the highlights of 28th August newsletter, Friday, every Friday. So today we have got four main points to discuss. The first point is regarding the H1N1 surge in many parts of India. You must have seen in the news media, Delhi, Karnataka, Haryana, all over India. And there have been some state governments have issued alerts. Some state governments have started testing, and that's okay. That is required to monitor whichever strain. So we want to reassure that H1N1 maximum, even the ICMR Director General, Dr. Bell, he gave a statement that H1N1 is self-limiting. What is being observed, though cases are there, because if you test, you will get large number of cases. This is the flu season, and 98% of the flu cases as on today are due to H1N1. But there is no cause for alarm because there is no high mortality, mostly self-limiting, and of course, few mortality always occurs in any viral, those who are bedridden, those who are comorbid, those who are frail. As on today, in this surge, there have been no excess mortality. One mortality was reported in July from Nagpur. There is no such directly attributed to. So, from UHO, we want to reassure that there shouldn't be panic, firstly. Secondly, related to this, we want to also state that as we saw in the past pandemic, that is the COVID-19 pandemic, there was a big demand for all other drugs were discouraged, in fact banned, like ivermectin or hydroxychloroquine, which are very cheap drugs. But remdesivir was promoted and it was sold in black 10 times, 20 times more than the original price. And subsequently, it was identified that it caused more harm than good, remdesivir. It caused kidney failure, other side effects, and it hardly had any impact on the morbidity and mortality, remdesivir. But the sales went up, black market for remdesivir. So this time, just remdesivir was promoted during the pandemic. Similarly, H1N1, we had a pandemic in 2009. That time, this drug Tamiflu, oseltamivir, was promoted. And there were a lot of conflicting studies. Some were saying it is beneficial, somebody, and ultimately, I remember that time the Cochrane summed it up that it has just 1 day advantage. The sickness lasts for 1 day less with without drug, and with drug you get an advantage of 1 day only, 24 hours. But again, there were pharma sponsor studies were showing benefit. Anyway, clinicians used to give it, and they used to say that if you give it early, results are good. But that is a catch-22 situation. If you are giving it early, how will you know that that particular patient to whom you are giving the drug would have gone into serious disease? You don't know. There is no way to know. Even without the drug, the person must have survived. May have survived. So that was the catch. And secondly, those who are not getting it, they may having severe disease. So there were a lot of biases and confounding factors. Last month in July, I think 26th or 27th, there is a preprint of a randomized controlled trial of Tamiflu, oseltamivir, which has expressed concerns that they have followed up patients, they are randomized, they have given one group Tamiflu, oseltamivir, and H1N1, other group they have kept. They found that the mortality was higher in those who got the Tamiflu, oseltamivir, and without any benefit in morbidity and mortality. No benefit, but there is higher. So we want to bring this to notice of the medical community that we have to use it very cautiously and have a good monitoring. This will be showing the actual paper also. So we one thing about UHO is we always verify the facts, authenticity. We never speculate as far as possible. If they are uncertainty, we express their uncertainty. But whatever we state, we try to back it up with. We will be showing the screenshots also of the relevant references which we have consulted. Second news today is very concerning. It is regarding the sale of seats in government medical college, MBBS seats. MBBS seats. Up till now, we were concerned about the private colleges that people with low score in NEET entrance exam were getting admissions because they could pay. A meritorious student with not so good marks would not be able to pay the fees for a private college, which goes into crore for a MBBS course average. And so with low marks, NEET marks, those who could afford it, they could get a seat. And a more meritorious student would not get it, would not be able to afford it in a private college. And he or she had a chance with good marks to get into the government medical colleges. But now there are news that there have been exchange of money. People who could pay could get a seat in a government medical college, MBBS seat with low marks by faking some document, some domicile, some NRI sponsorship and all. You pay lakhs, sometimes crore. They are agents who are operating. There are people in these government colleges. Some colleges in West Bengal and Rajasthan has come to light. Some agents, some undercover. Uh, some journalists did some investigative journalism and found. So this is a matter of great concern. We express our concern on this. Then another news related to paper leak only. This time it is a food inspector exam conducted by Maharashtra Public Service Commission. Those who go to and food hygiene, other things. Now we have got such a good FDA commissioner in Maharashtra, Mr. Tukaram Munde. He is doing such a great work of checking the quality and standards of food under FSSAI. But if his field workers are substandard, and this gives us concern when this news we saw that yesterday Times of India reported that there is a public service commission held by Maharashtra state for getting this job of food standard officer or food inspectors, those who work and collect the samples, take it to the lab. There's an exam, and one jilted lover, a boy, who gave a paper to his girlfriend, leaked paper. He got the leaked paper from somewhere. He gave it to his girlfriend, and girlfriend passed the exam of food inspector. And after that, there was a breakup. Their relationship broke. He was jilted, and most relationships are not lasting also nowadays. So, to spite her, he reported to the authorities that this paper was leaked. And there is now an inquiry. They found people in the Public Service Commission, some coaching institutes, and all the inquiries going on. These are times of it. So that UHO is very concerned, would bring it to the public notice that NEET is a high profile exam because doctors and MBBS, but other exams, they also may be lot of paper leaks, corruptions, unfair practices going on. Even in MBBS also, we have seen the government colleges. You pay money, there are ways and means to get into it. So this is something of, yeah, that if there been no breakup, nobody would have come to know. And we do not know how long this must have been going on. So that is one news we had, which we thought we'll share. And another last news we would like to share is about a drug, lecanemogir, or some antiviral drug for HIV prevention, pre-exposure prophylaxis of uh, HIV, AIDS. Like before exposure, you take some injection, and that generic drug has been rolled out. I mean, has been given permission to be rolled out without bioequivalence trial or clinical trials in India. The drug control CDS controller of drugs, and they have a special expert committee. They have cleared it without clinical trial or bioequivalence studies in. It is a pre-exposure drug for prevention of sexually transmitted HIV/AIDS, HIV. So this we are want to give our comments on this, like what is the trend nowadays is to focus on pharmacological solutions like sexually transmitted disease like HIV and including HPV virus also. We had a HPV vaccine which has been rolled out last year on a mass scale, in spite of the fact that there was a clinical trial in 2009 of the HPV vaccine in India under very false, under ethical violations, under false labeling. It was a clinical trial, but it was promoted as a demonstration study. But there were certain deaths of 7 girls during the trial, which of course they said it is association, it is not causal. So that is, but there was a big hue and cry in 2009-10. There was a 72nd Parliamentary Committee, Joint Parliamentary Committee. They indicted the ICMR and the Gates Foundation and Gavi and Path was the front. And report was tabled in 2013 August, Raj Sabha and Lok Sabha. And it showed that there were clear violations in promotion of HPV trial. There have been certain deaths which have we, so that was 2013. Now 2026, HPV, human papilloma virus, is said to cause certain strains, 16, 18, and a couple of more strains, to cause this, many strains, 9 strains. I think in the Western countries they are giving 9 strains. In India, the quadrivalent 4 strains have been rolled out. In spite of the fact that the trials, there was a misadventure. So this time they did not take a chance, the waiver of trial. No need to do trial of generic. So that's why we are expressing concern. That is one aspect about the safety aspect. Other aspect we would like to convey is that when these such drugs are promoted to prevent sexually transmitted diseases, HPV, the young people, the youth, the Gen Z, they will throw caution to the winds. They say, okay, why we have to change our sexual behavior? So that, of course, we don't want to be moralistic or judgmental. It's a matter of choice. But if you improve better lifestyle, and sexual behavior is part of lifestyle, we have thrown lifestyle out of the window when we are promoting fast foods, ultra processed foods, sedentary habits. Now, for sexual behavior, also, we are just neglecting the lifestyle education, safe sexual behavior, responsible sexual behavior, which could take care of number of sexually transmitted diseases, gonorrhea, syphilis, hepatitis B, hepatitis C, HIV/AIDS. Of course, you say now you have got even HPV vaccine may not be required at such a grand scale if we have. So we just wanted these two things, and I'll just, as I said, we always try to mm, indicate our sources. So these are our sources. So this is the first news that H1N1. This actually a seasonal. India is a country with a very high population density, so they and very large population. So the 4,000 cases in Karnataka or 2,000 in Bangalore. Bangalore itself may be having more than a crore population. So one should not get unnecessarily panic because they've seen the panic we have seen in the last pandemic. Panic can lead to a medical stampede. People with very mild symptoms may crowd the hospital, and genuine patients may be deprived of beds and ICUs. So this we have to keep in mind. And this is in Gurgaon. They are testing 100% people with severe acute respiratory infections. That is okay. That's the protocol. And 5% of people with influenza-like illnesses. So that is also okay for routine surveillance monitoring of the circulating strains. That is, I think, routine activity. And this is a very reassuring statement from in Hindustan Times, 25th August. 98% of influenza cases as on today in the present peak in India are due to H1N1, but there is no cause for alarm. This is ICMR chief. So severe cases and hospitalization are low. That's why. And now what happens now? Everybody is becoming so aware of even the slightest cough or ear, they get tested. So naturally, H1N1 test will. Earlier days, they have a flu, take some rest, some. And this was, as I said, that we have to be careful not to repeat the remdesivir mistake. The remdesivir was FDA drug, first approved drug, and all other drugs like ivermectin and hydroxychloroquine were condemned. And later it was found that it had a number of trial did not show any benefit and it had some side effects. So similarly, this is the one Tamiflu. Tamiflu in H1N1. So this is the latest study, which is a randomized controlled trial, 27 July 2026. This is a preprint. So they did followed up patients after random allocation, I think large number of patients, and it did not find any benefit, and this was the bottom line. Ineffective. It was ineffective and highly likely to increase 90-day mortality in critically ill patients with influenza. So we have to be careful for this drug. The medical community has to be careful. Perhaps more trials should be required in Indian conditions. And in a self-limiting disease with no mortality, it's very difficult to evaluate any intervention. So, but this should concern us that they showed a higher mortality. And this was another very concerning news, as I was saying, about the MBBS admissions fraud in government medical colleges. Government seats here, 18 lakhs, despite low NEET ranks. This is August news. This was in Dainik Bhaskar, which has been reported by a Docplexus site for doctors. 18 lakh for a government seat in West Bengal, and this is managed by faking some documents, NRI quota, non-resident Indian quota, fake documents, then 11 government medical colleges. So undercover journalists, they identified couple of agents. Agent one said that he has got contact with 11 government medical colleges in West Bengal, and 18 lakhs you give, and regardless of rank, you will get a seat. Seats were booked in advance by paying 4 to 5 crores. I mean, to the medical colleges. Imagine government medical colleges, how deep the rot has. Admission through West Bengal domicile quota also. West Bengal quota. Now people are having problem of getting domicile for SIR, but you could get MBBS seat by fake documents. So it's made a mockery of all. 10 years, a mother, you will get a domicile, mother's domicile for 10 years. 18 lakh for the seat. 1 lakh, every 18 lakh you get the seat, then 1 lakh every year. An NRI quota for 1.5 crores. So this agent offered documents and another alleged admission route, that was agent one. Agent two, see the bottom two paragraphs. Patna-based admission with government in West Bengal and Rajasthan, and also Nepal and Russia. Oh, that's a different. But West Bengal and Rajasthan, these two states has come to light with very low marks. So this is a matter of concern. And again, as I said, the paper leak for the food inspector job. So next Maharashtra FDA job exam. Man got paper for girlfriend, squealed after breakup. So this is so many exams are going in a country, and perhaps we don't know how much leak is going on. So this is again, we express our concern on this. And this is the, as I was saying, infections which are transmitted sexually. Young generation, we should be giving behavior education, behavior change communication, family life education, but we are focusing on pharmacological solutions in spite of certain mishaps of HPV vaccine in the 2009. And this is the editorial in Indian Journal of Medical Ethics, and 72nd Parliamentary Standing Committee report is available in the net. Anybody can search it, where unethical trials were done and they were 7 days. So this time perhaps they are not taking a chance. The special expert committee of the Central Drug Standards Control Organization has recommended waiver of bioequivalence studies and clinical trials. No need to do trials. Why unnecessarily get into conflict? And it has a generic injectable lenacapavir for pre-exposure prophylaxis to reduce risk of sexually acquired HIV in adults and adolescents. So that was a concern, that what message we are giving. We don't want to be preachers, but we have to see that without a proper trial, you do a trial, you have this in your toolkit, but what is the emergency? What is the emergency use authorization for this, for HIV/AIDS we are having for so many years, and it has been well controlled by awareness. So these are what all we have to say today. And if you want to contribute anything, we do not take any sponsorship for any pharma company or any political affiliation we have got. We are totally independent, free from all conflicts of interest, and we would like to sustain ourselves by independent donations without any conflict of interest. So that's all. So if you have any feedback, you can give us. Accordingly, we can take up the issues in the next session. So thank you for today. That's all for the newsletter today. Thank you.